Welcome back, mitochondriacs, for another episode of Cancer as a Mitochondrial Metabolic Disease. I am happy to be back with you today to discuss the next agent or compound in our discussion about the inhibition of glutamine, and in particular, this glutamine cysteine antipodar SLC7A11. And as I alluded to in the previous video, metformin has many other roles and mechanisms of how it could potentially help in the fight against cancer. As a reminder, if you're new to this channel, we welcome you, but this is going to be a very tough place to start. We're about video 66 in a long series titled Cancer as a Mitochondrial Metabolic Disease. And probably the easiest way to get into this would be just start at the beginning. But another way could be to watch this video, How Metabolic Therapy Checkmates Cancer, as a way to get oriented to what we're doing here and why. So without further ado, let's get into this next important topic. If you remember right, we left off talking about how sulfasalazine is an inhibitor of SLC7A11, this critical glutamine cysteine antipodar. And we also left off saying that there was some degree of synergistic impact between sulfasalazine and metformin. And I wanted to take today to discuss metformin and its potential roles within the metabolic approach to cancer. And in this paper, it is titled Metformin Induces Ferroptosis by Targeting MIR324-3P GPX4 Axis in Breast Cancer. And it says here that metformin is a widely prescribed hypoglycemic drug. Many studies have shown its anti-cancer properties. In the present study, we aim to explore the effect of metformin on breast cancer and clarify the underlying mechanisms. And it says here that further studies showed the effect of MIR324-3P was mediated by directly targeting glutathione peroxidase 4. And it says that in vivo studies showed that metformin induced ferroptosis by upregulating MIR324-3P in the xenograft model of breast cancer in mice. Our study suggested that metformin promotes ferroptosis in breast cancer by targeting MIR324-3P GPX glutathione peroxidase 4 axis. Metformin could act as a potential anti-cancer agent through the induction of ferroptosis. And as I'm sure you're already getting a little bit of a taste, this is a perfect time to talk about metformin and this role, because we're talking about things that we know can inhibit glutathione production, cysteine uptake, glutathione peroxidase, either expression or function, as well as affect the iron pool. And we know that all of those factors are important pieces in the ferroptosis story. And we can see here that they believe that metformin is working through this GPX4 axis, or the glutathione peroxidase 4 axis, as a way to enhance ferroptosis. Pretty cool. The next paper is titled Metformin Induces Ferroptosis Through NRF2 HO1 Signaling in Lung Cancer. And it says here the results showed that metformin treatment increased the level of MDA, ROS, and iron ions, while decreased the levels of GSH, TSOD, and CAT. Meanwhile, metformin treatment reduced the protein expression levels of GPX4 and SLC7A11, NRF2, and HO1, while the addition of ferroptosis inhibitor ferrostat-1 reversed the reduction. So a lot of acronyms here in this particular paper, but I want to break this down. So MDA stands for malondialdehyde, which is a known marker of reactive oxygen species and oxidative stress. ROS, reactive oxygen species, and iron ions were all increased. So therefore, it increased ROS within these cancer cells, these lung cancer cells. It increased iron availability and increased the labile iron pool. And then on top of that, it decreased the major antioxidants, glutathione, superoxide dismutase, and catalase, and reduced the protein expression of glutathione peroxidase 4 and SLC7A11, the transporter we've been talking about, as well as signaling through the NRF2 and HO1 pathways as a way to induce ferroptosis in a multi-step, multi-mechanistic fashion, which is pretty cool. And then what they did was they added an inhibitor of ferroptosis, this ferrostatin-1, and it completely reversed the actions of metformin. So I'm going to show you on the next graph how many areas that metformin is truly affecting when it comes to cancer cells and ferroptosis. So I have put metformin here in the middle, and I've talked about how it has inhibition by decreasing expression of this SLC7A11, the cysteine glutamine antipodar, which is responsible for bringing in the necessary components to make glutathione to begin with. In addition to that, through decreases in NRF2 pathway and HO1, this glutathione peroxidase is not necessarily inhibited, but it is less available to the cell because its expression is decreased. It's also having effects that are not shown here on catalase as well as superoxide dismutase, two very powerful internal antioxidant systems. And again, what's not shown here is it's increasing iron availability so that that iron can now have a better chance of interacting with an oxidant because the antioxidant systems have been blunted and creating lipid peroxidation and subsequently ferroptosis at multiple levels. So I was pretty blown away by this, but this next paper is titled Metformin Inhibits PPAR Gamma Agonist Mediated Tumor Growth by Reducing GLUT1 and SLC1A5 expressions of cancer cells. And it says here that metformin inhibited GLUT1 and SLC1A5 expression, leading to the reduced influx of glucose and glutamine in cancer cells, which is associated with reduced tumor growth. And if you want to go back to our classic kind of graphic here, we've talked about in the first couple papers that metformin is having an inhibitory effect on this SLC7A11 via reduced expression. It's also having, again, not shown in this graph, reduced expression of glutathione peroxidase, but it's also having a reduced expression of SLC1A5, which we have talked about in the past, which several of the compounds we've talked about have inhibitory effects on, but it's having effects on both this SLC7A11, which is, again, a glutamine cysteine antiporter, which is bringing in cysteine for the cysteine portion of the glutathione production, but it's also blocking uptake of glutamine itself through this SLC1A5, which is then going to, of course, participate in the creation of glutathione process. Pretty astounding. I'm going to set up the next slide well with this particular paper that was published in 2021. It says metformin induces ferroptosis by inhibiting UFMylation of SLC7A11 in breast cancer. And it says here in the results that metformin induces ferroptosis in an AMP kinase, AMPK, independent manner to suppress tumor growth. Mechanistically, we demonstrate that metformin increases the intracellular iron and lipid ROS levels. Specifically, metformin reduces the protein stability of SLC7A11, which is a critical ferroptosis regulator, by inhibiting its UFMylation process. Furthermore, metformin combined with sulfasalazine, the System XC, aka SLC7A11 inhibitor, can work in a synergistic manner to induce ferroptosis and inhibit the proliferation of breast cancer cells. And we're going to look at this for a second here. So basically, metformin, because it's blocking this UFM1 process, decreases the stability and availability of SLC7A11. That, of course, is going to have direct effects on bringing in cysteine to make glutathione. So glutathione is decreased. Then glutathione's lipid peroxidation prevention is now inhibited, and we have more lipid ROS, which leads to ferroptosis. And that is also shown here. So remember, metformin is blocking this UFM1 process, which is responsible for the stabilization of SLC7A11, this cysteine glutamine antiporter that we've talked about repeatedly. And now we have decreases in this transporter on the cell membrane. Less cysteine is getting into the cell, less glutathione is being made, less glutathione peroxidase is being interacted with, and there is now increased lipid ROS. And I would say I missed one thing here, that it is also increasing the amount of free iron that is available inside these cancer cells that is now interacting with lipids and creating lipid peroxidation and subsequently ferroptosis. And why this paper sets up the next one is that we saw in the last video that sulfasalazine has a synergistic impact, because sulfasalazine is actually blocking, in a more traditional sense, SLC7A11, and metformin is blocking the stability of SLC7A11. So we have less SLC7A11 available to be utilized for the transport of cysteine and glutamine. And we have sulfasalazine acting in combination because it's actually blocking the protein. What is left that gets to the cell surface is being blocked by sulfasalazine in a very synergistic manner. In addition, we have the increases in iron, as talked about in the prior paper, which is helping induce ferroptosis because SLC7A11 is now not able to keep up with the antioxidant effects needed to prevent that from happening, which leads to increased cell death in breast cancer specifically, but likely in a very conserved fashion across multiple tumor types, because multiple tumor types use this mechanism as a way to protect itself against oxidative therapies. And in this particular paper, it's showing that they use radiotherapies as a way to increase ROS. or reactive oxygen species. But again, we've talked about this in the past that it can literally be high dose IV vitamin C. It could be HBOT. It could be possibly ozone therapy. It could be radiotherapy. And it could even be some types of chemotherapies that could enhance the ROS to provide the final death blow or the final pulse that is needed to get the job done. I hope you're starting to see the repetitive nature of these talks because there are very well conserved Achilles heels that are utilized within cancer across the board, and that is the reliance on glucose and glutamine. But I would also say that the reasons for those glucose and glutamine substrates are not always well explained on other platforms. You would be left to believe that it's only for energy production for these cancer cells, and that's far from the truth. It's also heavily relied upon for biosynthesis of molecules that are required for replication of cells, but also for protection of cells. And we've been focusing heavily on the protection of cells through glutathione and glutathione peroxidase to prevent reactive oxygen species from taking over, leading to oxidative stress, and in particular, iron oxidation, lipid peroxidation, and ferroptosis. Even as a conventional doctor, I'm not a huge fan of using pharmacology here, especially for the prevention of disease, not a huge fan. And treatment of most disease, I'm not a huge fan. But I do think that in this particular setting, the case could be made that limited amounts of pharmaceuticals, such as sulfasalazine, such as metformin, as well as other pharmaceuticals, could be utilized in a synergistic way. Again, not for the rest of your life, but as a way to synergistically achieve your health goals, and in particular, the eradication of cancer cells that may be in your body. And I think that even the most anti-pharmaceutical folk like myself could be open-minded enough to think that, okay, this is a limited amount of time. We have a very specific goal, and it makes sense biologically. Why not add this to the mix? Of course, that's a discussion between you and your treating physician, but I think it could dovetail into the foundations of metabolic therapy, which would be, of course, the therapeutic ketogenic diet, calorie restricted for the right person, as laid out in the initial ideations of Press Pulse. If you like videos like this, please like. If you have people in your life that you know could utilize this information or could benefit from this information, please share it with them. If you're not a subscriber yet, please go ahead and subscribe. And until next time.